Welcome to another episode of the Senior Focus. As you know, our goal is to provide information to improve or maintain a person's quality of life. And today's show is a very important show. We're going to talk about multiple sclerosis, we're going to talk about Parkinson's disease, and most importantly, we're also going to talk about the Godosphere. And with me today, and I'm Nick Kaltzis, your host, with me is Dr. Peter Riskin. Dr. Riskin is the director of the Multiple Sclerosis Clinic at UMass Medical Center. He specializes in multiple sclerosis. Dr. Riskin, thank you for joining me today.
Thank you so much for having me.
You're board certified in neurology, is that correct?
Yes.
What exactly is board cert? What does that mean?
Well, first you have to be board eligible, which means you have to do a certain amount of training, a medical school internship, 3 years of neurology, and then you have to pass, when I did it, an oral examination and a written examination. So it's pretty rigorous.
And you know, you talked about, you had to go to medical school and so forth. How long have you been a doctor?
I graduated in 1975.
Okay, so it's been some time.
Yep.
And where did you go to medical school?
I went to, I'm a Texan,
Okay.
so I went to University of Texas Southwestern Medical School in Dallas.
And as far as your clinical interests, what would those be?
Well, I would say that my clinical interest is in the clinical care, first off, of people with MS and with related diseases of the central nervous system.
What exactly is MS? MS, everyone knows MS, multiple sclerosis.
Right.
What exactly is that?
Well, interestingly, we probably can't give you a precise answer to that yet, but what we know is that that is an illness typically acquired in adulthood, but it can be acquired even in kids, young kids. It's a lifelong illness. We believe that the main cause of this resides in the immune system, and that there's an incorrect recognition of part of the brain, probably the myelin, which is the insulation. Probably the immune system is incorrectly seeing that as a foreign invader and is thereby attacking it. So it's in the family of autoimmune diseases like lupus and rheumatoid arthritis.
Is there anything specific that drew your interest to MS?
Yes. So actually I had previously had a different subspecialty within neurology. I was a neuroendocrinologist.
Which means?
I studied the brain and hormones.
Okay.
And although that was intellectually very fulfilling, I didn't find that I was taking care of diseases that I thought were serious enough, and I didn't feel that it really took advantage of the things I like to do as a physician, including doing my physical exam. I take pride in doing a very good neurologic examination. I had outstanding training in neurology at Mass General, and so I decided to switch. So I've been doing MS now for over 20 years. But
during the time that you've been a practicing physician,
yes.
Have you noticed an aging demographic in your patients? I mean, everyone knows that population is aging at, I don't want to say an alarming rate, but we'll say an accelerated pace. Are the patients that you see becoming older and older and older?
No, in fact, a few weeks ago I saw a 14-year-old girl.
Okay.
So although there's a prominent effect of age on MS in terms of the timing of disability tends to correlate with age, and when you hit middle age, that's when disabilities tends to become more evident. But we see it in young kids, and there's probably an increasing incidence of MS, particularly in women. And those are usually young people. So we're seeing still unfortunately, lots of young people with MS.
So as far as when you say like a correlation with age, if I heard you correctly, you said like middle age, the signs and the symptoms become more pronounced?
Correct.
So is it a degenerative disease?
Well, things have changed in the way we thought about MS. So when I started off, we thought this was almost entirely a disease of the myelin, which is the insulation. And the model of MS that we thought most about was an animal model in which there's lots of inflammation. And now we understand that this is a neurodegenerative disease. Inflammation may be very important, particularly early on, but probably the main cause of disability is somewhat separate from inflammation, or at least the degeneration part of it becomes independent of inflammation.
Probably 14, 15 years ago, maybe a little longer, I was very, very sick. And they did test me for Parkinson's disease, multiple sclerosis. They couldn't find anything, I think what the neurologist told me was clinically, there's nothing wrong with you, but we can see that there are tremendous problems that you have. Of course, my condition improved. If someone is diagnosed with multiple sclerosis, can their condition improve?
Oh, sure. So I should say, as an aside, I actually was at one point in time, after I was an MS doctor, I was actually worked up for MS, which I don't have.
Okay.
But I can understand what it's like to be evaluated for MS. So yes, particularly if people are coming in soon after an attack, for example, very frequently we're able to help them improve from those symptoms. And sometimes with our new treatments that are very potent, people can improve from where they were at the point that they started treatment. So improvement is not a rare thing. And in fact, one of the most rewarding things about being an MS doctor these days is that more and more we have really good drugs, really powerful drugs, and perhaps more than other kinds of neurology, we are seeing people come in dire straits, and we're treating them, and often there's a very clear improvement.
One of the things that intrigues me is we hear an awful lot on the news or in the media that Ann Romney suffers from multiple sclerosis.
Right.
And one of the things I heard is she had an attack recently as a result of whatever campaign activities she was involved in. And you also mentioned an attack. I guess I'm not quite certain what that means. How can someone have an attack, not just suffer from the disease?
Right. So about 85% of folks with MS start off with the attack form.
Okay.
And that means there are periods of time in which they would appear to the outside world to be in remission.
Normal. Okay.
They look normal. In actuality, oftentimes if we were to do a daily or weekly MRI, we would see they're actually not entirely normal and there's stuff happening.
Right.
This is not on treatment. And then periodically they will have a obvious attack, meaning that usually over a few days to a few weeks they develop a new symptom. They often feel tired. They may need steroid treatment, and it may last for weeks to months, and then they usually improve. So that's superimposed upon another process, especially later on in MS, where there can be gradual worsening. And that actually is the bigger problem in MS, that's progression.
Now, is the diagnosis of an individual with MS a difficult thing?
Well, I gave this answer once before, and I really like my own answer, which is only if you do it right.
Okay. Okay.
So in some cases, the medical student could get the right diagnosis. The trick is not jumping to the obvious conclusion, and that's actually one of the things we specialize in the MS Center at UMass, which is being very thorough and thoughtful and hopefully not jumping to the obvious conclusion.
And what kind of diagnostic procedures or tests do you employ?
Right. Well, the most important diagnostic test is a long visit with a neurologist and a very careful history of the events, followed by a very careful neurologic examination. Those are the two most important things. And then probably the next most important thing is an MRI.
When you say neurological evaluation or a workup, what kind of things do you do?
So when I'm doing a neurologic examination, I'm determining whether there's intellectual problems. I'm looking at whether the eyes move entirely normally or if there's weakness of the face.
So like you do an astigmatus test.
Exactly.
You move your finger and you watch the
I'm
tracking of their eyes.
Testing for weakness,
okay,
so forth. I'm looking at reflexes to see if there's
When you say
evidence.
testing for weakness, are you like squeezing their hands, seeing if they can push against you?
So squeezing the hands, actually, I was just telling a resident this morning, is a lousy test.
Okay, okay.
Typically, it's a pretty detailed evaluation of many different muscle groups. So for example, the patient might be asked to hold this position, and I then try to pull the arm out, and that's testing the biceps. And so I do that left, right, and certain muscle groups get tested pretty carefully. I pull pretty hard to find weakness.
In the event that someone's diagnosed with multiple sclerosis, what kind of treatment protocols are there?
Right. So it depends a bit upon what we identify at the beginning as their risk factors. So if it's someone that's in the middle of an attack, they may well get steroid treatment by vein. If they're clearly having an awful version of MS, very, very aggressive, very active MRIs, and they have risk factors suggesting that they may have one of the terrible forms of MS, we might actually graduate directly to one of the more aggressive treatments.
Okay.
But the ordinary person that comes in that's had an attack, and we've done an MRI and we see stuff that looks like MS, and we've done blood tests to eliminate other causes, and the story and the exam and the MRIs and so forth all look like MS, in that case we start them on what are called first-line agents, and those are all, except for one, those are all shots.
Okay.
There is one pill, which is an FDA-approved pill, and we actually hope and expect that in the next year there will be 2 more pills. Plus, we have a number of very powerful intravenous drugs that are quite strong.
All the treatment that you've mentioned would seem to be, at least in what I would categorize as a non-invasive. There's no surgery. There's like shots,
Right.
pills,
Right.
that type of thing.
So the most invasive sorts of things that we would do would be a spinal tap.
Okay.
That used to be the routine for
Yeah,
somebody.
that was one of my questions. When
Yeah.
I was sick, they must have
Yeah.
given me 10 spinal
Yeah,
taps.
well, I had one myself, as
Yeah,
I said.
yeah.
That's not as big a deal as many people have this concern about, but we don't do that anymore unless there's some issue as sort of the diagnosis is more difficult to be certain of, or especially if we think there might be some other thing that's looking kind of like MS but isn't.
What caused me the greatest concern was that when they did these lumbar punctures, I was shaking like a leaf.
Yeah.
And I thought to myself, well, is the physician able to go where he needs to go when I'm sitting there shaking?
Yeah. Well, hopefully your physician wasn't shaking.
No, he wasn't. He was good.
Yeah.
They did it a number
Okay.
of times, but it did cause me concern.
Yeah.
As far as like physical manifestations,
Right.
what kind of things might someone suffer from?
From the spinal tap?
No,
Oh.
from the multiple
From MS.
sclerosis. Yeah.
So first off, this is one of the worst things about this disease is that you can be feeling fine and everything's great, and then the next day you feel crummy, and then 2 days later you have a paralyzed leg, and your bladder control is not normal, and you have double vision or imbalance, or any number of things can happen. You can have intellectual problems
Okay.
where you have difficulty
So when you
expressing
say-
yourself.
When you say
Yeah.
intellectual problems,
Yeah.
I would refer to them as cognitive impairments.
Right.
So there can be cognitive impairments with MS.
Right. So about a third of people eventually have a fairly significant cognitive problem.
Okay.
And for example, commonly people have problems with multitasking,
Right.
which of course a lot of our patients are women, and almost all women have to do lots of multitasking, so that can be a problem.
Is this
Memory can be a problem.
Is this something that affects more women than men, or a particular race, or?
Right. So actually, yes. So it's about 2/3 or more of patients are women.
Okay.
That ratio is probably actually increasing, so proportionally more women are getting more MS than men. It's especially a disease of Northern European white people, and especially of people that have Scandinavian ancestry. So they're talking about English, Irish, German, and so forth. But you can be a African American and get MS. You can be an Asian person from any country in Asia and get MS. You can certainly be Hispanic and get MS. And unfortunately, when African Americans get MS, they tend to get a worse form than when other people get it.
Just quickly, because I'm going to have to head to a break right now. Every physician that I've had on my show has espoused the virtues and the benefits of exercise. Is exercise something that can improve a person's condition if they have multiple sclerosis?
Absolutely. So there's very good data that exercise helps with fatigue, which is perhaps one of the most important symptoms of MS. Exercise will help maintain the muscles that are still working reasonably well, and will strengthen them so that you have less chance of falls and so forth. There is good evidence and increasing evidence that stress is actually a cause of MS flares and MS disease activity, and exercise reduces stress. So
Well,
I think exercise is a very good thing.
There you have another physician that espouses the benefits and the virtues of exercise. Dr. Erskine, thank you for joining me
Thank you.
today. We're
Appreciate
going to head
it.
to a break right now. When we come back, we'll be joined by Dr. Summer.
Millbury Healthcare Center is a highly respected 5-star deficiency-free skilled nursing and rehabilitation center. We are renowned for our compassionate care and specialty programming, making it possible for your next step, returning home. We listen and take the time to understand your goals. We provide support and the tools needed to safely prepare for your transition home. Millbury Healthcare Center is the community choice for skilled nursing and rehabilitation.
Does your loved one suffer from memory impairment, dementia, or Alzheimer's disease? Consider Dodge Park Rest Home in Worcester. Our geriatric medical team and nursing staff are available 24 hours a day. We offer medication administration and incontinence care with dignity. Our activity programs are designed to engage and stimulate the mind. And with Dodge Park Rest Home, you can better protect your estate and save your assets with only a 1-year look back. Your loved one will feel safe and at home with Dodge Park Rest Home of Worcester.
This is Virgil Gibson. Join me at the Hanover Theater on October 13th for a great night of music and comedy to benefit St. John's Food for the Poor. Buy your ticket. And they'll close the funding gap so construction can start on Worcester's new St. John's Food for the Poor Center. Purchase your ticket now by calling 877-571-7469.
Tired of weather reports that don't focus on Central Mass? Introducing Worcester Weather, the only video weather report for Worcester. Worcester Weather is easily accessible 24/7 by visiting chartertv3.com. It is updated throughout the day to give you the best video forecast possible. Worcester Weather also airs at 5 p.m. during the Jordan Levy Show and every Worcester News Tonight telecast. Worcester Weather gives you the local forecast you have always wanted. Worcester Weather on Charter TV3 and chartertv3.com. Brought to you by Berterra Nissan of Auburn.
What is this?
That is clam chowder.
Now that I've eaten all of this, did you watch me sneaking to eat the chowder?
I believe that bowl is empty, isn't it?
Pretty much. Did you see me doing it so that Jeannie wouldn't get a shot of me eating? Because then it will show up in a promo on Channel 3.
You better chow down or it's gonna get cold, so eat it. I don't care if you're full, just eat it. Eat it. Open up your mouth and feed it.
Charter TV3 and UMass Memorial Healthcare have teamed up to bring you the latest news and trends in healthcare. Health Watch, presented by UMass Memorial Healthcare, brings you the healthcare topics that are important to you. From stroke prevention to allergies, skincare to sports injury prevention, and nutrition to pregnancy, Health Watch and UMass Memorial Healthcare informed you on the issues that affect you on a daily basis. Health Watch on Charter TV3. For extended interviews with UMass Memorial Healthcare experts, log on to our website.
I'm Caitlin Tivnan from Worcester News Tonight. Thank you for choosing Charter.
Welcome back to the Senior Focus. I'm your host, Attorney Nick Holsis, and now I'm joined by Dr. David Summer. Dr. Summer, how are you?
I'm great.
That's good, and I'm happy that you could join us today. Thank you for taking time out of your schedule to come on to today's show.
Thanks for having me on.
You are the director of the Parkinson's Clinic at Reliant Medical Group, is that correct?
That's correct.
All right, and you're also board certified in neurology, is that correct?
That's also correct.
Okay.
Dr. Riskind already laid the groundwork.
He certainly did. He certainly did. You know, similar to my question to Dr. Erskine, what is multiple sclerosis? What is Parkinson's disease?
So, Parkinson's disease is a neurodegenerative disorder.
Okay.
And we've known that. So that means that the brain cells stop working appropriately and individual brain cells die in this disease. That affects a lot of people with increasing frequency as you get older. So
Okay.
the older one gets, the higher one's risk of manifesting Parkinson's disease is. And it affects a lot of areas in the brain, but the most prominent things that get affected are the areas that control movement, and in particular speed of movement. And about 70% of patients with Parkinson's disease have a tremor as well, but you don't have to have a tremor to have Parkinson's.
Okay, so when we talk about motor skills, you hear people talk about fine motor skills, gross motor skills. What kind of impairment might someone anticipate if they have Parkinson's disease?
So both fine and gross motor skills are affected.
Okay, and I suppose I should ask what the difference is between the two.
Sure. Well, I mean, one of the gross motor skills that is often affected in Parkinson's is walking.
Right.
And walking is an important thing to do. And what happens with people in Parkinson's is typically the walking slows down and the steps get shorter. And there's also a phenomenon that occurs in Parkinson's called freezing of gait, whereby you try to take a step and the foot just doesn't move right. So you get this halting kind of appearance, or people may have trouble getting started with walking or trouble turning.
Is there a loss of balance, or is there an imbalance problem?
So there is a balance problem that comes with Parkinson's, and the problem is a loss of postural reflexes and the ability to right oneself when one starts to fall. So if you were standing up and I came up and bumped you, without even thinking about it, you can change the way your muscles are activated in your legs and your trunk to catch yourself and you don't fall over.
I couldn't, I would fall down.
Maybe.
Yeah.
But someone with Parkinson's, that reaction to a disturbance of posture is impaired.
Is it neurologically induced, or is it like rigidity in the muscles, that type of thing?
So it is from the brain.
Okay.
Not the primary problem is in the brain
Okay.
processing, not in the muscles themselves.
And other than a balance problem, or we'll say gross motor skills, walking, what other kind of physical, are there speech problems?
So basically, anything that you do with a muscle can be impacted by Parkinson's disease.
Okay.
So there can be vision difficulties related to the muscles of the eyes. So it's not a blurring of the vision, but it's a difficulty with scanning. So to be able to look to you or look to the camera, I have to bounce my eyes back and forth, and that ability to move the eyes quickly can be affected. So it can make it hard to read, hard to scan the road when you're driving. Speaking, swallowing can be affected. Handwriting, buttoning buttons, eating with utensils can be affected. So anything can happen that involves a muscle if Parkinson's affects that. But a lot of people do very well with all of these things. So I have many patients who have had Parkinson's for many years and still do all of their daily activities themselves without assistance.
Let's talk about tremors. When I was sick, I was told by my neurologist that I had essential tremors, and he said, we did diagnostic tests. You do not have Parkinson's disease. You have essential tremors. What's the difference between the two?
Sure. So I don't want to revisit your medical care.
Okay, sure, of course.
But so the essential tremor is the most common movement problem that people have. Okay, so up to a couple of % of the population, depending on how you measure it, manifests essential tremor. And it's usually not something that you have while you're sick. It's usually a lifelong condition.
Okay.
And it can be exacerbated by different things, by being tired, by caffeine intake, by certain medications, by other physical stressors and psychological stressors. But essential tremor is a regular high-frequency tremor that usually affects the arms, usually affects the head, and it typically has this kind of appearance to it, fairly quick. And as you try and reach for something, the tremor gets worse.
Right.
Okay. Whereas the tremor that comes, the typical, or I should say classic Parkinson's tremor, is a slower resting tremor that occurs about this speed, or you can sometimes see it if you're not paying attention. You may get this kind of movement in a limb. And the Parkinson's tremor is usually one-sided to begin with, and it can spread to the other side, but it usually remains asymmetric. Essential tremor can be either symmetric or asymmetric. So it's, but the two tremors look different. There are patients that have both, and you can have an action tremor as part of Parkinson's disease, and there are some people who, especially if they develop a new tremor that looks like essential tremor late in life, I monitor them for a few years to make sure we're not missing Parkinson's disease. I guess one other thing I want to say that your statement brings up is you said I was tested for Parkinson's disease and I didn't have it.
Right.
So the gold standard diagnosis of Parkinson's disease is a clinical evaluation. So much like Dr. Riskind was talking about, it's looking closely at the patient's neurological function, movement of the eyes, movement of the limbs, what the muscles feel like as you move them with and without distraction. And there's a whole series of motor tasks that have been standardized for the assessment of Parkinsonism.
Mm-hmm.
So Parkinsonism is the motor features of Parkinson's disease. And there's a motor section of a scale called the Unified Parkinson's Disease Rating Scale. And this is a standardized instrument that's used around the world to score people on how they do with various taps, tapping their fingers, opening and closing their hand, various aspects of walking. And that's really the key to diagnosing Parkinson's, is what the physical exam looks like, and then ruling out other things that may be causing those features or mimicking that. So sometimes an MRI, for instance, is performed in the evaluation of somebody with newly diagnosed Parkinson's disease, but you can't see Parkinson's on an MRI. You can't see Parkinson's with any blood test. There is one nuclear medicine study called a DAT scan, which is a form of a SPECT scan, which has just come into this country within the last year.
Mm-hmm.
So there's only a handful of people that have had them in the United States that does correlate with Parkinson's disease. And it was approved by the FDA to differentiate between Parkinson's disease and tremor. However, most of the time that differentiation is made clinically. So by and large, there is no test for Parkinson's disease.
Okay.
The diagnosis of Parkinson's disease is made clinically. And the best person to make a diagnosis of Parkinson's disease is somebody who's seen a lot of Parkinson's disease.
Right.
So that could be a movement disorder specialist like myself, or a neurologist, or a geriatrician who's seen a lot of people with Parkinson's.
And one of the things that I was, I don't know if the word is surprised by, with the essential tremors that I had, I didn't have them all the time. I only had tremors when I didn't want to have them. When I tried to hold a glass of water, when I tried to hold something or reach for something, only then would it manifest itself. Otherwise, you would never know. And with Parkinson's disease, I presume that those tremors just are
right. So
unknown.
it's the classic textbook way of thinking about it is that essential tremor is an action tremor. It comes out when you're trying to do something with the affected limb. And Parkinson's tremor is a rest tremor. It appears when you're not paying attention to the limb. And early in the disease, most patients with the tremor-dominant form of Parkinson's disease, where the rest tremor is what shows up first, most patients will tell me that they can stop it. If they notice that they're having the tremor, they can stop it. As the disease progresses, they can't stop it.
Okay.
But it tends to go away when you think about doing something with that extremity.
Now, you mentioned that, and I think you mentioned that as a person ages, they're more likely to contact the disease?
That's correct. So one of the things that we've learned about Parkinson's disease from a scientific standpoint is that the changes in the brain associated with Parkinson's disease, those changes that you can, so I said you can't see Parkinson's on an MRI, right? But you can actually see Parkinson's disease at autopsy, okay? And what we've learned is that the changes in the brain tissue that you can see at autopsy are present for years before people develop any of the clinical symptoms of Parkinson's disease. But if you look at clinical diagnosis, starting, there are isolated rare cases of people with Parkinson's in their teens, in their 20s, in their 30s. It's still very uncommon to get Parkinson's into your 40s, but starting in the 50s, it becomes more common, even much more common in the 60s, and it becomes even more common in the 70s, and in the 80s it kind of plateaus. But in general, the older you get, the more likely you are to manifest the first clinical symptoms of Parkinson's disease
So
and receive that diagnosis.
Even though they're older, when they manifest the symptoms, they may have the disease and just not know it. Is that what you're saying?
That's correct.
Okay. As far as, we'll say, typical symptoms, physical manifestations, other than a walking problem or a shaking problem, are there other problems?
So for typical Parkinson's disease, and I don't want to get into too much detail here, but there's many things that can cause Parkinsonism, the slowness of movement, the stiffness in the muscles, and the most common form is idiopathic Parkinson's disease. So that's typical Parkinson's disease.
What about like mood disorders or cognitive impairments? Is that something that can be visited by someone with Parkinson's disease?
So I'll get there in 1 second.
Okay.
But the drugs can cause a syndrome that mimics Parkinson's disease, certain medications, both past and present exposure. Stroke-like damage on the brain can cause a syndrome that mimics Parkinson's. But if you look at the typical, and then there's some rare diseases that we won't talk about for the sake of time, but if you look at typical Parkinson's disease, about 2/3 of patients will first notice a resting tremor, but other common presentations are slowness in gait, shuffling gait, a feeling of stiffness or weakness on one side of the body. One arm just feels stiff or weak, and another common one is actually shoulder problems. I've seen several patients where they get diagnosed with a shoulder problem, even go on to have shoulder surgery with an orthopedist, and then you go back and look, and that was the first sign of their Parkinson's disease, is that they were getting shoulder problems because that arm wasn't moving well because of rigidity and bradykinesia, the slowness of movement.
Is Parkinson's disease something that's difficult to diagnose?
Sometimes.
Okay.
So much like MS, sometimes you see someone walk into your clinic and I know within 15 seconds of seeing them that they have Parkinson's disease because there's sort of a classic appearance to it. Sometimes it's a diagnosis that takes some time. Parkinson's is a progressive disease, and so for better or for worse, the diagnosis becomes easier the more time that goes on. It's hardest when the very first symptoms emerge.
Dr. Summer, thank you for joining us today.
Thank you for having me.
We're going to have to head to a break right now. When we come back, I'm going to be joined by Marilyn Talley and Robin Sestaro.
Does your loved one suffer from memory impairment, dementia, or Alzheimer's disease? Consider Dodge Park Rest Home in Worcester. Our geriatric medical team and nursing staff are available 24 hours a day. We offer medication administration and incontinence care with dignity. Our activity programs are designed to engage and stimulate the mind. And with Dodge Park Rest Home, you can better protect your estate and save your assets with only a 1-year look back. Your loved one will feel safe and at home with Dodge Park Rest Home of Worcester.
Millbury Healthcare Center is a highly respected 5-star deficiency-free skilled nursing and rehabilitation center. We are renowned for our compassionate care and specialty programming, making it possible for your next step, returning home. We listen and take the time to understand your goals. We provide support and the tools needed to safely prepare for your transition home. Millbury Healthcare Center is the community choice for skilled nursing and rehabilitation.
Coverage from Central Massachusetts for Central Massachusetts.
A brand new facility now stands in the shadow of the former Worcester State Hospital.
The witnesses say they saw 4 young men pour gasoline on a piece of furniture and set it on fire. Police in Northborough are asking residents to take extra precautions after a series of break-ins in town this week.
Reporters in the field and an in-depth local forecast. Worcester News Tonight on Charter TV3.
The Arthritis Foundation moves people to move together.
Today is a celebration. We're here to support our daughter and walk to find a cure for arthritis.
My whole entire family's here to support me.
This is the best way that we all can get the word out and raise awareness and raise funds for research.
Reach out to your family, friends, neighbors, and coworkers today.
This is Virgil Gibson. Join me at the Hanover Theater on October 13th for a great night of music and comedy to benefit St. John's Food for the Poor. Buy your ticket, and they'll close the funding gap so construction can start on Worcester's new St. John's Food for the Poor Center. Purchase your ticket now by calling 877-571-7469.
I want to thank Jim Polito for leaving. I was so excited when I came into that because today is National Kiss Your Chicken Day. Well, here it is, my Chick-fil-A. I figured I'd eat it right on the air. I support Chick-fil-A's owner's right to say what he said. So as I got to the bag to pick it up, I said, what the hell's in here? My highlight of the show will be, when I come back, is to eat some sauce. And I'm not going to get any chicken, so I'm going to have to eat sauce. Thanks, Jim.
I'm Siobhan Connolly from Worcester News Tonight. Thank you for choosing Charter.
Welcome back to the Senior Focus. I'm your host, attorney Nick Halsis, and I'm here with Marilyn Talley and Robin Sestaro. And we're going to talk about the Goddess Fair.
Great.
It's a wonderful event.
Thank you so much for having us here, Nick. We're very, very excited.
It's my
about
pleasure. Thank you for coming in so we can talk about this.
Wonderful.
You know, as I said at the beginning of the show, really everything is about maintaining an individual's quality of life and hopefully improving their quality of life. As an elder law attorney, whether it's personal needs planning, whether it's legal planning, the whole idea is to try to bring to bear whatever the person needs to maintain their quality of life, and that's precisely what the Goddess Fair attempts to do. Maybe one of you can tell me a little bit about the Goddess Fair.
Thank you. I'd like to just begin. Last year, it actually, first of all, I just want to thank Millbury Healthcare Center. Our administrator, Christine, is so behind doing this, and that's what actually allowed us to do this. Last year, we spoke about having a fair, a health and wellness fair. And because I was an oncology nurse in the past, I always felt that it was just as important for healthcare to have complementary therapy. So I asked her if, in addition to health and wellness, we could have the addition of some massage therapists, and then some psychic readers asked if they could participate. And it was such a lovely event. We expected 100 people to show up last year, Nick. We had over 250. And people just said it was such a spiritual, wonderful fair that they just had never been to anything like that. And it is always meant to be a fundraiser. So last year we actually, the proceeds were $2,500 that went to the Abbey's House. And this year we decided to split the funds between the UMass MS Clinic and the Reliant Medical Center's Parkinson's Clinic. So we're just very delighted about that.
There's so much need for the funding, particularly in today's difficult economic conditions. For you to be able to conduct some kind of fundraising and provide funds that are really critical and necessary for both the MS Clinic and the Parkinson's Clinic is a very, very good thing. It's a great thing. Where is the Goddess Fair going to be held?
The Goddess Fair is going to be held at the College of the Holy Cross on September 6th from 5 to 10, and it's going to be in the Hogan Center. And just to get back to the support, we actually have 3 wonderful sponsors: Teva Pharmaceuticals, Fairlawn Rehabilitation Hospital, and Elder and Disability Law Advocates. And they just came forward and said, how can we help you? In addition to several vendors in the community, it's really the community pulling together to give back to the community. I just find that is just so heartwarming.
And did we say what day it occurs?
September 6th.
And that is a Thursday.
It's a Thursday, 5 to 10.
And does it cost money for people to attend this event?
Yes, it'll be $30, and they can get their tickets either calling me at Millbury Healthcare Center. Number is 508-713-4424. And they can request their tickets. I can either hold them at the door, or they can come to Millbury Healthcare Center and purchase them.
You know, they can get tickets by asking for Donna at Elder and
Absolutely.
Disability
Absolutely.
Law
Yes.
Advocates at 508-755-6525 as well.
Excellent.
You know, the fact that last year you put on the event, like you said, you expected maybe 100 people, there were over 200 people.
Yes.
So, you know, there are people that are interested in the events that will occur that particular day. Let's talk about some of the things that are going to occur that day.
Do you want to share a little bit of that?
Sure. We have many therapists. We have everything from Reiki, angel card reading, tarot card, massage therapy. It's just going to be a wonderful event of therapists and coming together and learning about health and awareness. For $30, you come in and you get to choose between a therapy and a reading. Food will be there as well as a cash bar. I don't know if you want to add to that.
Great, and we'll also have, for the first time this year, we'll have a sound healing.
Oh, yeah.
That will be a half an hour earlier in the evening, and then later on, if people decide to stay after our medium, who's going to do a presentation, it's Heather Clockadell, Heather O'Malley Clockadell. She's actually a well-known author in the area. She's written 2 books, as well as a medium. So people are very excited to see her also.
The events that are scheduled to take place on September 6th at the fair. I think it was Dr. Riskin who said that you know, when a person suffers from multiple sclerosis and you know, to have some kind of a relaxation is very helpful for them and helps with the treatment of their condition. The things that are offered, like you had indicated, Reiki, massage, polarity, channeling, that type of thing, is, I think, am I correct to say, is geared toward helping people learn how to relax?
You know, that's a facet of it, absolutely. I think it's nice for people to first, they're coming out to support the community, but also, Nick, just as you said, to just even let them know about Reiki and chair massage, things like that. Some people that have already responded and bought tickets said they weren't aware of these things and they'd like to have a little experience, a 20-minute session, you know, for the Reiki, or a 20-minute for a chair massage. I think that will be great.
Let's talk about Reiki.
Okay.
What is Reiki?
Okay. Reiki is actually a hands-on form of transfer of energy from one person's hands into helping a person relax and sometimes healing. And I know I shared a story with you about that about a week ago. And I actually am a Reiki practitioner, and my dad actually fell and broke his shoulder. He's 87 years old, and he was in terrible pain. No matter what they were giving him, he was really having a horrible time. So I asked him, I said, Dad, would you be willing for me to try a Reiki treatment on you? And he said, I'm willing to try anything at this point. So he laid down in his bed in rehab, and I did the Reiki treatment on him, and he fell fast asleep. And I just was so beside myself. But he told me afterwards, when he woke up, he just felt the pain melting away, and he just felt his muscles relax, and he just went to sleep, and it was wonderful. So after that, we actually had someone do a Reiki treatment 3 times a week on him. And within 3 weeks, when he returned to the orthopedic doctor, they said they were so shocked his shoulder that had not been healing at all was completely healed.
You know, I think that the idea of, I like to call it alternative medicine.
And I like to call it complementary.
I was going to say, others involved in the medical industry seem to call it complementary medicine.
Yes.
But I want people to understand complementary in the sense that it complements whatever other treatments are available.
Absolutely.
We're not talking about free treatments.
Right, right. And just as Dr. Summer and Dr. Riskin said, in addition to the treatment they would prescribe to their patients, they could also suggest to them to go get a massage once a week, to try to find a Reiki practitioner. There are so many other complementary therapies out there that they could utilize. It would really just help them.
Well, I think the idea of stress reduction is very important for people that are suffering from these particular neurologic disorders.
Yep.
And you know, for someone who's undergoing or feeling a lot of stress, you know, it really does exacerbate their symptoms.
Absolutely.
So if someone were interested in a Reiki treatment, are they able to get a Reiki treatment at the Goddess Fair?
Absolutely. In fact, I've asked all of the practitioners that will be there. We're going to have 25 massage therapists there. I asked them all to bring their business cards,
That's a
so
lot
they
of
practice in the
therapists.
community. People have just come out of the woodwork, Nick, to support this. We are just so blessed, aren't we, Robin?
Yes, absolutely.
And Robin is she's in the facility, she's getting phone calls every day, several phone calls from people that are interested
Now,
in participating.
is Reiki the type of thing that you can just teach someone, or is it, well, say, a transference of skill, of knowledge? Like, can you just tell someone about it, or does it help them more if they're a participant and they get that knowledge through participation?
You would actually go to a class and be trained how to do that and practice on people within the class, and then they require you to have so many hours towards practicing while you're getting up to, they actually have 3 different levels before they consider you a Reiki master.
We're going to have to head to a break right now, but
Okay.
when we come back, I want to talk about some of the other events that are available
Great.
at the fair.
Thank you so much, Nick.
Very welcome.
Thank you.
Millbury Healthcare Center is a highly respected 5-star deficiency-free skilled nursing and rehabilitation center. We are renowned for our compassionate care and specialty programming, making it possible for your next step, returning home. We listen and take the time to understand your goals. We provide support and the tools needed to safely prepare for your transition home. Millbury Healthcare Center is the community choice for skilled nursing and rehabilitation.
Does your loved one suffer from memory impairment, dementia, or Alzheimer's disease? Consider Dodge Park Rest Home in Worcester. Our geriatric medical team and nursing staff are available 24 hours a day. We offer medication administration and incontinence care with dignity. Our activity programs are designed to engage and stimulate the mind. And with Dodge Park Rest Home, you can better protect your estate and save your assets with only a 1-year look back. Your loved one will feel safe and at home with Dodge Park Rest Home of Worcester.
Charter TV3 and UMass Memorial Healthcare have teamed up to bring you the latest news and trends in healthcare. Health Watch, presented by UMass Memorial Healthcare, brings you the healthcare topics that are important to you. From stroke prevention to allergies, skincare to sports injury prevention, and nutrition to pregnancy, Health Watch and UMass Memorial Healthcare informs you on the issues that affect you on a daily basis. Health Watch on Charter TV3. For extended interviews with UMass Memorial Healthcare experts, log on to our website.
I'm Steve Wayner, Chief of Police for the town of Dudley, with some safety tips for child awareness when driving. Use caution near school buses. Keep your eyes open for kids getting on and off the bus. Drive slowly through intersections and crosswalks. Our kids are back in school now, so let's work together to keep them safe. The safety of our children is everyone's priority. This safe driving message is brought to you by the Central Mass Chiefs of Police Association and Charter Communications.
Don't miss Canal Fest 2012, Saturday, September 8th from 11 to 5 on Harding Street in the exciting Canal District, downtown Worcester. Great food, live entertainment, arts and crafts, hay rides, kids activities, plus prizes, raffles, and more. And a giant replica of the canal itself, along with its colorful history and bright future. Canal Fest 2012, Saturday, September 8th from 11 to 5 on Harding Street in downtown Worcester. For more information, visit blackstonecanalfest.org.
Join me on the Hank Stoltz Experience. You know, people are always asking me, what is the experience? Well, that's the beauty of it. It's everything that has to do with Central Massachusetts. From the politics of the region to the great events that are going on each and every weekend or every night right here in Central Mass. It's everything that's going on. It's everything that you want to know about. And just like Kelly Square, where the traffic never stops, we never stop either. There's no red lights on the Hank Stoltz Experience, only on Charter TV 3.
I'm WTAG's Jordan Levy. Join me on the Jordan Levy Show weekday afternoons on Charter TV3. And thank you for choosing Charter.
Welcome back to the final segment of the Senior Focus. I'm your host, Nick Kalsis. I'm here with Marilyn Telly and Robin Cestaro. You know, Marilyn, what other kind of events are available for people at the Goddess Fair?
We have so many things going on.
You really do have a lot of things.
It's amazing. So when people actually come in, there's going to be a line for people that have bought their tickets ahead of time. And then we'll also be selling tickets that evening. But as soon as you buy your ticket, you get in line, you sign up for your reading. You have a choice of 4 different readings, which is going to be 20 minutes long, as well as a 20-minute psychic reading.
You know, what's important for people to understand is it's interactive.
Absolutely.
So, yeah, you buy your ticket, but you don't just sit in a chair and take information. You participate with people, and you know, you have hands-on benefit by being there and participating in these particular events.
Absolutely. And we have such beautiful space at the Hogan Center. They were very generous with us. So in addition to
it's a beautiful place.
Isn't it beautiful?
Yeah, it really is very nice.
It was just surreal when I walked in there. I knew we were meant to be there. But we're also going to have something new this year called a sound healing session. And it's a group of 3 musicians that play different instruments, including a Tibetan bowls, the drums, some instruments from Australia. And what they will actually do is have people sit around them, and the half-an-hour session is supposed to decrease your stress and just allow healing to take place. So that will be from 5:30 to 6:30, 1 hour. And then at the end of the evening, at around 9:15, for anyone that wants to stay, they will have another session because they want the readers and the therapist to be able to attend that.
You know, I'm looking at the various events that occur, and the one thing that I don't see is meditation.
You're right. We don't have meditation, but I think that's going to be more like a one-to-one thing that that would really be intense. This is, you're right. And we're exploring things,
Yeah, when I think of stress reduction or relaxation, I mean, I think that would go beautifully. Tell me about massage.
We actually have
Reiki's
some
a form
great...
Is Reiki a form of massage?
Reiki is a form of massage, yes.
Now, when you undergo Reiki, when I think of massage, I think of someone actually working the muscles.
And this is actually hands-on. You move your hands to different parts of the body.
Right.
And I've actually had a treatment myself that you can actually feel the warmth from someone's hands. And it feels like a transfer of energy. It's amazing. But we also have polarity, which is almost on the idea of acupuncture. People are more familiar with acupuncture, that it almost sets your body back in balance if you've been under a lot of stress.
You know, when I was sick, I underwent acupuncture treatments probably once or twice a week.
It's an amazing thing, isn't it?
You know what? It was amazing. I couldn't talk, and the doctor said to me, you know, I see that you can't talk. Stick your tongue out. And I thought to myself, I'm at the doctor's office. He wants to see my tongue. I stuck my tongue out. He sunk 8 acupuncture needles in my tongue, probably 4 or 5 inches deep, like, you know, into my tongue. And then he hooked them up to like a car battery. And the next day or 2 days later, I could speak again.
No,
yeah, it was
that
really,
is
really,
amazing.
it was mystical. It was relaxing. The effect was immediate, and it really was amazing.
Wow, it's almost miraculous, isn't it?
Yeah, you know, I think it kind of was miraculous, to be honest with you.
That's great.
And you know, I think that whether it's acupuncture, the Reiki, the polarity, you know, I see chakra readings. When I think of these things, I think of energy centers in the body
Absolutely.
that, like you said, need to be placed in balance.
Absolutely, yeah, very good. Something too that we have new this year is a henna painter.
Yeah, what
a
is
woman
it?
that's very well known.
What is that?
She actually uses a form of, it's like a dye that's called henna. and she'll actually can paint people's hands, maybe just make a little design like a tattoo or something. So I'm very, very excited about that. She usually works at much larger fairs and has her own table, but she heard about this being a community
And
event.
what's the idea of henna painting?
Just decorative, just something fun to do. A lot of times some cultures will do it before a wedding.
Right.
It's just a very festive thing, almost like putting on a fancy piece of jewelry.
You know, sometimes you take a look at, I don't know if you want to call it acupressure or something where, you know, there's a graph of particular pressure points or something in your hand where it affects different parts of your body. So I'm wondering if that henna painting is based on the same
That I don't
ideology.
know, and we are going to have to ask Shara that night. Thank you. That's a
You're
good
very
point.
welcome. You're very
and I
welcome.
know it's what you're referring to may be like a reflexology.
Yeah, there you go,
Yes.
reflexology.
And we are going to have some practitioners doing reflexology that night also.
And with respect to reflexology, what do they do?
Actually, they can work on different parts of your body. A lot of people think it's just centered on the feet, which a lot of it is, but it can be your shoulders, it can be your head, it can be your hands. And again, they're trying to just recenter different stress points in your body.
You know, I wanted to ask Robin a question. There is a program, I believe, at Millbury Healthcare Center for, what is it called, a breathing clinic or something
Called the
like
Better
that?
Breathers Club.
A Better Breathers Club at
Right.
the Millbury Healthcare Center.
Right,
Okay.
right. The club is actually, it's being formed. It's for COPD patients, which is chronic obstructive pulmonary disease. That can include emphysema, chronic bronchitis. It also can include asthma, exactly. And it also other breathing problems such as lung cancer or pulmonary fibrosis disease. And what it is a support group, an education group. Our first meeting will be October 11th. It's at 11 o'clock. It will be at Millbury Healthcare Center. Our first speaker will be Dr. Saylor. He is the president of the American Lung Association, and this is who we are doing this with.
Is there any cost for people to attend this?
No, no. We would encourage people who have lung disease or COPD, as well as their caretakers, because their caretakers can also benefit from just the support, the education, just being together with somebody who has problems breathing and can relate to each other. We hope to have it once a month, and I think it would be beneficial to anybody who is in need of that education.
Now, I want to take this opportunity to thank both of you for coming in
Thank
today.
you. Oh, thank
It's
you for
really
having us. It's a
a wonderful event, and it's really provides funds for very worthy causes. And I want everyone out there to know, if you have any questions about our program today, the Goddess Fair, feel free to email the Senior Focus. You can email me, Nick, at theseniorfocus.com, or feel free to call our offices, 508-755-6525, and get information on this tremendous event. In any event, thank you both for
Thank you
joining
so
me
much.
today. I
Pleasure.
appreciate it.
My pleasure.
Thank you.
Thank you, Nick.
Join us next week.